That is really one of the worst public health disasters we've ever faced in this country. I mean, COVID has been very tough, but the overdose crisis. I got to tell you, every Monday I hate Mondays because I get an email from the city staff that tells me how many people died in the previous week, and and how many overdoses our firefighters responded to. I actually haven't I haven't had the strength today to open that email, but I know from last week, the previous email, we had 6 people who died and 150 responses to overdoses from our firefighters. And so what that's doing to our frontline our frontline responders, whether they're firefighters or peers that we pay to help us, it is creating trauma among that workforce, and I hate to say high suicide rates and time off of work. So it is a huge burden on the people that are dying, overdosing and dying, but also the people that are responding and providing care. So the overdose task force that I struck came up with a number of solutions. The first is to decriminalize the possession of small amounts of drugs. That will, meaning that if you're caught with a small amount of heroin or fentanyl or cocaine, not a lot, but a little bit, you're not arrested by the police because, again, going through the criminal justice system is not what these folks need, and the police agree. The police have backed me on this decriminalization effort, as have the public health authorities. It also means the police don't seize the drugs, and it doesn't say force people into activities they wouldn't normally do, like criminal activities or say sex work. But that is only part. I would say, of the 10 people that are affected, decriminalization may save 2 of those people. But safe supply it's we know through COVID that it was only a healthcare response, a public health response that saved us. It was only through believing in science and embracing vaccinations and masks that we didn't have a much more widespread tragedy. And this has to be the answer when it comes to addiction. When no substance is known, if you have an addiction where you need to say use drugs 8 or 10 times a day, and you don't know where those drugs are coming from, and you don't know what's in them, you're playing Russian roulette every time you inhale or inject these drugs. So we need a regulated supply of drugs, which would come through safe supply, provided by healthcare professionals. And so I can't tell you right now, but we do have a very exciting announcement coming up in the coming weeks regarding safe supply here in the city of Vancouver. So please stay tuned for that. It won't, of course, solve the problem, but I think it will provide an example of how we have to move forward. We already have 8 overdose prevention sites here in the city. So you can imagine the tragedy if we didn't have those. We haven't had a single death in an overall overdose prevention site, which is important to know. They have been backed by the best scientific research. We have to keep those going, but still, we're losing 1 person a day here in the city, and we have for 4 years. So, and I have to say, one Monday morning when I opened the email, it was my own family member that was one of those statistics. So this is something that's deeply personal to me. And I know that the city believes in the same thing I do. It's only through a health response that we'll be able to fully address this issue.